What I'd like to present on these slides is the great influenza pandemic of 1918-20. It impacted Nova Scotia in a major way, as it did all over the world, actually. The estimate is that 35 to 50 million people died from this influenza in the world. And in Canada, we had about 36,000 people who died. So I'm going to focus in on Nova Scotia then, and I'm going to talk about where to come from, what was it, and what was Nova Scotia's experience. The origin is somewhat controversial. One group of people feel that it came out of China, as did this coronavirus that we're talking about today in the news, but there is a very good evidence that this influenza epidemic of 1918 came out of Kansas, the state of Kansas in the United States. And one reason why we think that that was the case is that Dr. Loren Miner, who was a doctor in Kansas, he wrote soon dozens of his patients, the strongest, the healthiest, the most robust people in the county, were being struck down as if they had been shot, and he referred to it as an influenza. Dr. Miner tried to treat it. At that time, there was diphtheria and tetanus antitoxin, and he used those, but without success. The important thing he did was to advise the U.S. Public Health Officer in Washington of the influenza, and that report from Dr. Miner has survived and is the earliest mention or notice of the influenza of a severe type. Unfortunately, next to the small village in Kansas where Dr. Miner was, there was the second largest army camp in the United States with 56,000 soldiers in an overcrowded and unheated barrack and tents. On March the 4th, the influenza appeared within that camp, and within 3 weeks, 1,100 soldiers were down with the influenza. At that time, the United States was very much involved in the war, so they didn't want the general public to know that influenza had broken out in that army camp. And so they censored all the newspapers in the United States. In other words, refused to have any of the newspapers in the United States say anything at all about the fact there was influenza in a large army camp in Kansas. And they were successful at censoring all the newspapers in the United States. They sent the soldiers from that army camp to the east coast of the United States and over to Brest, France, where they disembarked in France in April. As one would expect, a major influenza epidemic broke out among the French and British armies in France in mid-April 1918. In June of 1918, British soldiers who were returning from Europe, from France in fact, to England, introduced the influenza into England. It broke out among the German army as well, and in fact, German Commander von Ludendorff had to postpone and later cancel a major offensive because many of the German soldiers were ill with influenza. The estimate is between 200 to 300,000 soldiers in the German army were down with influenza by late June. By July 1918, influenza had broken out in Italy, Holland, Norway, Sweden, Portugal, and Spain. Now, all of the countries that were involved in the war censored their press. Spain wasn't involved in the war, it was neutral. So the uncensored newspapers in Spain reported on the severity of the epidemic in that country, and it became known as the Spanish influenza. It's sort of a misnomer because, of course, it didn't start in Spain. It just so happened that Spain was the only country that was saying something about it in their newspapers. 5 million deaths of Spaniards took place from the Spanish influenza. The arrival of the Spanish influenza in Nova Scotia takes place in September 1918. 1st of September, we have a death from the Spanish influenza at Belcote, Inverness County. And during the first part of September, we have 9 people dying in Inverness County from the influenza. In Halifax, or near Halifax at Beachville, there was the first death on the 11th September from the influenza. By the 22nd of September, 500 American soldiers arrived in Sydney. They were on their way from Boston to overseas to Europe, but influenza broke out on the ship, and they had to drop into Sydney in order to have the soldiers treated. The next day in Yarmouth, we have the first influenza case in western Nova Scotia. It was brought in by Gloucester fishermen who frequently did visit Yarmouth and a number of seaports around Nova Scotia. And they brought in the influenza, and it spread throughout western Nova Scotia. Halifax, on the 26th September, we have influenza on a number of ships in the harbor. The Niobe, which was a naval vessel, the Donegal, and the French cable ship Jeramec. It was really bad in Massachusetts the month before it broke out in Halifax. So the governor of Massachusetts called on Halifax for nurses. And Halifax really couldn't refuse because the previous year, of course, we had called on Massachusetts for nurses during the Halifax explosion. So without a doubt, Nova Scotia decided to send nurses to Massachusetts. On the 19th September, 2,500 soldiers were ill with influenza at Camp Devens near Boston, with 70 deaths. Dr. William Welch, who was a professor at Johns Hopkins University, he visited Camp Devens, and he immediately called on Dr. Oswald Avery in New York to find a vaccine. We'll talk about Dr. Oswald Avery in a little bit later. On the 28th of September, 6 nurses left Halifax for Boston. On the 30th of September, we have a whole unit of VG hospital nurses leaving for Boston. The Medical Society of Nova Scotia meets, and several doctors volunteer to go to Boston. 85,000 influenza cases were in Boston by 30th of September, with over 1,200 deaths. Now, what was the response of Nova Scotians to the influenza? By the 27th of September 1918, we had the first meeting of the City Health Board, and their minutes show no mention of the influenza at all. In other words, they weren't aware that the influenza was in Halifax. The mayor of Halifax in 1918 was Mayor Hawkins, and he was a doctor, and he objected to Ottawa. In fact, he wrote to Ottawa, and he was objected to the fact that they were putting sailors with influenza in the Cogswell Street Military Hospital. Now, the Cogswell Street Military Hospital was located at the corner of Gottingen Street and Cogswell Street, exactly where Staples is located today. It was a large hospital with 150 beds, and it now had influenza patients in it. And you can imagine people who worked there, such as nurses, such as cleaners, cooks, and so on, would go home from the hospital and take the influenza with them. So it broke out in Halifax, and that's why Mayor Hawkins was so concerned, because he realized that was going to be the way that it would get into the general public in Halifax. By the 2nd of October, the Gloucester fishermen brought influenza to Petit de Gras, which is in Richmond County in Cape Breton. It's a fishing community, and the Gloucester fishermen came in there to buy supplies, and they brought the influenza to that part of Cape Breton. Dr. Hawkins arranged for 3 Halifax doctors to leave for Boston to assess the epidemic and to report on preventive measures to be implemented in Nova Scotia. They immediately, after they arrive in Boston, they send their findings to the doctor and with recommendations. By this time, there were 2 deaths from influenza on Lawler's Island. Now, Lawler's Island was a quarantine station for Halifax, and it's an island, as you may know, between McNabb's Island and the Eastern Passage, and it had been used for quarantine since 1868. The public health officer in Nova Scotia, Dr. William Hattie, gets involved and issues a statement on the symptoms and the treatment of influenza. He informed the public through the newspapers that the disease is prevalent outside of Halifax, but even by the 2nd of October, he's not aware that there are any cases in the city of Halifax. By the 4th of October, things change. There are 64 cases of influenza reported in Halifax. Lawler's Island Quarantine Hospital is full. Many influenza cases at the Cogswell Street Hospital, several cases of influenza in North End Halifax. Now a third person gets involved, Dr. McKay, who's the quarantine officer for Halifax, and he takes the recommendations of the 3 doctors who went to Boston to heart, and he recommends to the Board of Health the closure of all public places in Halifax, including schools, churches, and theaters. By the next day, Dr. McKay's recommendations are implemented and everything is closed. Now, just to say a little bit about some of the people involved here, Dr. Arthur Hawkins, 56 years old. We're very fortunate that he was the mayor of Halifax during that year, 1918. Graduate of McGill, he had been the coroner for Halifax, he had been an alderman for Halifax, and he was mayor, as I say, in 1918. The public health officer, William Hattie, was also a graduate of McGill, and he was very well experienced. He had been a superintendent of the Nova Scotia Hospital, had been the public health officer for Nova Scotia for many years, and after the explosion, he became the assistant dean of medicine at Dalhousie. The third person, chairman of the Board of Health, Dr. Norman McKay, age 67, he graduated from the Halifax Medical College and also graduated as a surgeon in England. He was a professor at Dalhousie and chairman of the Board of Health and quarantine officer, Port of Halifax, for many, many years, as you can see. Fortunately, they did collaborate with one another or sort of agree with each other as to what should be done. So by the 7th of October, all the classes at Dalhousie and the Nova Scotia Technical College were canceled, and we get the first listing of influenza cases, 200 of them, and the first mention of a death by Dr. Hattie. They built an isolation hospital on Morris Street. It opened to receive influenza cases. Morris Street at that time extended right up to Roby, and the isolation hospital was on the south side of Morris Street, which really was University Avenue today. 7 more nurses leave for Boston. Dr. Hattie gives 14 instructions to prevent infection from influenza, and he publishes them in all the newspapers in Nova Scotia. The main instruction is to isolate yourself. Don't associate with anyone. Don't let them sort of breathe on you or give you anything that will transfer the influenza to you. So people went into isolation, particularly families, would not allow their children, well, they weren't allowed to go to school, but they also prevented the children from even leaving the house, if they could possibly control the children, which I gathered that probably they were able to at that time. Now, the next thing that happened, which around the middle of October, is different doctors around the world were trying to come up with a vaccine for influenza. Timothy Leary at Tufts College in Boston said he had one. It turns out that none of these vaccines were of any value whatsoever because the vaccines were developed to treat bacterial disease. And as we're going to find out, the influenza wasn't a bacterial disease, it was a viral disease. And very little was known about viral diseases in 1918. On the 12th of October, Dr. Hattie reported there had been 40 deaths from influenza in Nova Scotia. Now, during October, the number of deaths increased dramatically, as shown by this slide, plotting the number of deaths in Nova Scotia against all the days in October. And you'll notice that there's a very rapid increase taking place here by this red line. In fact, there's 482 deaths in Nova Scotia during the month of October 1918 from influenza. The worst day being around the 21st, 22nd of October, when we had 35 deaths on that day in Nova Scotia. And it continues to increase. If we take a look at what happened during the year 1918 and also 1919, you'll notice that in October there were, as I say, 480 some deaths, but we had a large number of deaths in November and also in December. And then it gradually dropped off, and it really ended up with no deaths in June of 1919. A total of about 1,700 deaths in Nova Scotia during that period. If we look at the death rates from influenza for the various counties of Nova Scotia, we have the estimated population of each county and the number of deaths that are reported to have taken place. Now, these numbers come from the Vital Statistics Department of Nova Scotia, which received death certificates from doctors throughout Nova Scotia. And I had the opportunity of going through all the death certificates. They're now at the Nova Scotia Archives across the street from Dalhousie. So I was able to come up with numbers of how many people died in each county, and also to work out the death rate per 1,000, and you can see the numbers there. You'll notice that the highest death rate was in Richmond County because of the Petit de Gras deaths due to the Gloucester fishermen visiting that fishing village and bringing a lot of influenza with them. The next largest was Halifax with 5.2 deaths per 1,000. Cape Breton, again, it was quite large at 4.2. So the average death rate for Nova Scotia was around 3.4 per 1,000, which we'll talk about a little later. Places like Lockport were on the Atlantic Ocean, seaport, fishing village. They had a tremendous number of deaths. And this is a list of the people who died there during October. And one thing you can notice about the people who died during that month in Lockport was their age. Their ages are essentially between about 15 and 40. You do have one or two that are children, but most of them are between 15 and 40, and that's very, very interesting to note. This was from the Liverpool newspaper, The Advance. If you compare the deaths in Nova Scotia in 1918 and 1919 with a previous year, and I picked the year 1913 and 1914 because it was before the First World War. And if you compare those deaths, so we have the number of deaths against age groups. You'll notice on the horizontal we have age groups, and so 0 to 4 years, 5 to 9 years, 10 to 14 years, and so on. One would expect that there wouldn't be a large difference between the number of people who died in the two age groups, that is, the age group 0 to 4. You'll notice that in 1918, 19, there were a few more deaths than there were in 1913 and 14. And that same observation applies for the age range 5 to 9, 10 to 14. However, when you get to the age range 15 to 19, it looks like there's a large number of deaths in 1918 and 19 compared to 1913 and 14. If you move to the age range 20 to 29, there's double the number of deaths in 1918-19 as there were in 13-14. And the same when you get to the age group 30 to 39. Those people are dying from Spanish influenza. In other words, it appears from the data that the Spanish influenza didn't bother children between the age of 0 to 14 very much because they were totally kept isolated from everyone else by their parents. And then you'll notice that from 40 to 49 and later age groups, there's very little difference between the number of people who died in the 2 years. The reason for that is that if a person was over age 40, they would have lived through what was called the Russian influenza of 1890. And their bodies would have built up antibodies against the virus. And that's why people between 40 and 49, you'll notice there's practically no difference between the number who died in those 2 years. So the effect of the virus was really on people between 15 and 40. And in fact, 60% of the people who died in Nova Scotia were in that age range. Now, the influenza lasted right into 1920. And during 1920, 282 Nova Scotians died, death rate of 0.55. However, in 1918-19, during that 8-month period, about 1,764 died with a death rate in the range of 3.4. So that it lasted really 3 years, but the difficult or the tragic years were 1918 and 19. Now it's interesting to compare the death rates from influenza for Nova Scotia to other provinces of Canada, and in fact to Massachusetts. So we have here the population of those provinces in 1918, the number of deaths that took place in those provinces, and the death rate. And as I said, our death rate was 3.47. If you look down the list, you'll notice that there's some provinces with very, very high death rates. For instance, Saskatchewan at 7.42, which is double the death rate for Nova Scotia. And in Massachusetts, the death rate was 6.02, which again is very large compared to Nova Scotia. The lowest was Ontario at 3.1, but other provinces, Alberta, Quebec, were much higher than Nova Scotia. Now the reason for that is that the three doctors I have mentioned, Hawkins, Hattie, and McKay, took action immediately to try to isolate people from other people and to try to inform people as to how to deal with the influenza, particularly by isolating themselves, staying away from people, not touching anything that anyone gave them, don't even accept your mail. And when you go to the grocery store, wear a mask and stay a very, very short time, only long enough to buy what you need. The grocery stores were only open for an hour a day, most places in Nova Scotia. By the way, the closure of churches, schools, and theaters, bowling alleys, and just about everything, public place, those places were closed everywhere in Nova Scotia, all towns in Nova Scotia, for 6 weeks during October, November of 1918. So now we get to the question, what caused the influenza in 1918? Well, the word influenza is a very general term, and it has been used down through the centuries to describe any inflammation of the upper respiratory tract. In 1918, influenza pandemic was initially thought to due to bacteria, Pfeiffer's bacteria. And it really wasn't until 1931 that an English researcher named Richard Scope isolated the influenza virus in 1931 in swine. And Andrews isolated the influenza virus in humans in 1933. It was only then that epidemiologists realized that the causative agent for the 1918 pandemic was viral rather than bacterial. Now, to understand the difference between viruses and bacteria, we have to look at the antigens of virus, the characteristics of a virus. And there's two main antigens. They are hemagglutinin and neuroamidase. Now those are actually projections on the virus. That is, they determine its shape, its external shape. Hemagglutinin spikes bind to the receptors of cells lining the respiratory tract and actually penetrate through the cell nucleus, allowing the genes of the virus to take control of the cell's function. Once they take control of the cell's function, they then are able to reproduce themselves. Viruses can't reproduce themselves unless they use the energy in the cell of a host, that is, a cell that they attack. And in this case, they're attacking cells lining the respiratory tract. Neuroamidase destroys the binding capability of the cells, that is the host cells, allowing new viruses that are created due to the multiplication of virus cells to burst from the cell and invade other cells. So we have a case here of almost a chain reaction. Once the antigens of a virus attack host cells, the whole situation starts to develop very, very rapidly so that it really erodes the cells lining the respiratory tract. And usually what happens then is pneumonia attacks the respiratory tract and the person dies of influenza and pneumonia. And it takes place very fast. In fact, it takes place so fast that it can kill a person in one day. And it was wondered for years what was happening, and it was explained by a Dr. Macfarlane Burnett in Australia He said it was an acute inflammatory injection, very rapid necrosis or death of most of the epithelial lining of the bronchial tree down to and especially involving the smallest bronchioles and alveolar walls. The immune system of young adults mounted such a massive immune response to try to fight off the antigens of the virus that it resulted in their lungs filling with fluid and debris, including blood. In other words, they died in their own blood, which came into their lungs. This prevented an adequate exchange of oxygen and led to the death within 1 or 2 days. Very sad situation. And autopsies revealed that this actually what was happening with those people between 15 and 40. They were drowning in their own blood. Well, it's nice to end in a little more happy note. Was there anything positive that came out of this miserable experience, which was the worst pandemic that mankind has ever experienced? And of course, there were some important things that happened. Prior to 1918, Canada didn't have a federal Department of Health. But in 1918, in March, the Borden government decided to establish a Department of Health, federally. Nova Scotia had a Department of Health, but it was only manned by one person, and that was Dr. Hattie. So they reorganized the Department of Health in Nova Scotia and added more people. Dalhousie University obtained a grant from the Rockefeller Foundation and established a public health clinic, which opened in 1922. And the building still stands, as you know, on University Avenue. And the Dean of Medicine happens to have his office in that building at the present time. And Dalhousie medical program added a course in public health and in prevention, given a much higher priority in the study of medicine than it had been in 1918 or before 1918. So that's the story of the Spanish influenza and how it affected Nova Scotia. Thank you.